A bit of an introduction to two key terms that we use in medication called pharmacokinetics and pharmacodynamics of medications, and I'll explain what that means in a moment. Their application in the elderly, and particularly a few words about drugs and delirium. We talk about the rights, 7 rights. And so this is like a bit of a take-home message. We want to give the medication to the right patient. We want to use the right drug. We want to try and use the right dose. We want to try to give the drug in the right route. If we don't have to give IM injections or IV injections, better to try and use oral medications. We want to try and give that drug at the right time, and that's why we need to have a little bit of knowledge about pharmacokinetics. We want to stick within the Regulations Act, and I'm sure, as Stella has just given you an overview of that and the importance of that. And lastly, we want to have the right to refuse. And sometimes as nurses, that's a bit of a challenge for us. If a person says, no, I don't want to take this medication, I don't like the taste of it, I don't like the way it makes me feel, but the doctor's prescribed this to you, you must take it. So there are issues around consent, and the patient always has a right to refuse. Just leading on from that, so we really need to know our patient. We need to do our own assessment of our patient and our patient's needs. So you need to know your patient. You really need to have a profile and understanding of what the real issues are for them. Do they have the capacity to consent? If you go to the GP and you've got a chest infection and the doctor says, I'm going to give you some antibiotics for your chest infection, you have the capacity to understand what that medication is going to do to you. You would understand the outcome of taking that medication. You would hopefully might be able to go on the net or the web or Google it or something and find out what sort of side effects that particular drug is going to do. But do your patients have that same knowledge? So you have to understand that if they don't have the ability to and the capacity to consent, that you should be discussing that with their carers. I'm sure you will do that. But the capacity to consent is a big issue, I think. It's great, it's important to have a clear goal and a treatment path. What are we using this drug for? What intervention are we hoping to achieve by that particular medication? And what's our treatment